Today, we will talk about how to treat patellofemoral pain syndrome. Let's have a look at the details. Patellofemoral pain is the pain you can have around or behind your kneecap, patella. This pain is sometimes called runner's knee, as it's common in athletes. Patellofemoral pain can get worse when you run, walk, sit for long periods, or squat. Patellofemoral pain can be treated at home with rest, ice, and over-the-counter medications. If your pain does not clear up on its own, consult a doctor. Physical therapy, and in rare cases surgery, are sometimes required for patellofemoral pain. The first step is treating the pain at home. Stay off your knee until the pain passes. If you're experiencing pain in your knee, take some time to rest. Overexertion can make the pain worse, and possibly cause other complications. Try the RICE method. The RICE method is a classic means to treat knee and joint pain. RICE stands for rest, ice, compression, and elevation. Application of the RICE method can help reduce patellofemoral pain. Take over-the-counter medication. Over-the-counter medication can help manage pain. Painkillers such as ibuprofen, which also have anti-inflammatory properties, can be particularly helpful when treating patellofemoral pain. Use braces and knee taping with caution. While knee braces and knee taping are often recommended to lessen swelling and inflammation, take caution when taping your knee or using an over-the-counter brace. The second step is seeking medical help. See a doctor if the pain doesn't pass on its own. Usually, patellofemoral pain will pass over on its own with rest. However, if your pain persists despite at-home treatment, make an appointment with your physician to have your knee evaluated. Start physical therapy. Physical therapy is usually recommended for persistent patellofemoral pain. Depending on which knee muscles are causing the pain, you will engage in a variety of exercises to help alleviate knee pain. Ask about medical shoe inserts. Medical shoe inserts are frequently used to treat patellofemoral pain, as inadequate arch support can cause or worsen the pain. Talk to your doctor about where and when you should wear shoe inserts, and whether this is a good option for your patellofemoral pain. Have surgery, if necessary. If your pain does not respond to non-surgical treatment, surgery may be necessary to address the underlying causes of patellofemoral pain. Keep in mind surgery is very rare, and it is unlikely your pain will require surgery. In the event you need surgery, your doctor will decide on the type of surgery that best alleviates your patellofemoral pain. And, the third step is making lifestyle changes. Build muscle with strength training. Strong hips and quadriceps can help your knees stay healthy. If you suffer from patellofemoral pain on a regular basis, engage in a strength training program to keep your body strong. Lose excess weight. If you are overweight or obese, you're more prone to patellofemoral pain. Talk to your doctor about starting a weight loss program that will help you shed excess pounds. Warm up before exercise. Warming up before exercise can reduce your risk for patellofemoral pain. A warm-up is a light exercise you engage in before jumping into a strenuous workout routine. You may sweat slightly during a warm-up, but you should not feel fatigued. There are several different ways to warm up before exercise. Stretch regularly. Stretching is vital to preventing patellofemoral pain. Before and after exercise, invest in some light stretching to prevent joint pain. There are several ways you can stretch to cut back on pain and fatigue. Invest in quality footwear. Choose shoes that fit you well. If you strain to put shoes on, consider investing in a larger size. Shoes should have solid arch support. You should not overdo wearing heels or flats, especially for long walks. Thanks for watching this video. Please don't forget to like and subscribe to our channel if you like our videos.